Know Your Numbers, written by Dr. Step Harris. I am not a medical doctor, but I have noticed some people would rather do cartwheels and backflips than to go to a doctor. If you are temporarily hurting, what are you waiting on? It may be nothing, or it may be something that needs immediate attention. Next year's insurance premiums may be higher, and some people may or may not even have medical and dental coverage next year. Consider using your medical insurance and going to see a doctor. Doctors normally get really booked towards the end of the year, and it may be difficult to even get an appointment. Are you worried about the copay or co-insurance percentage or whatever you have to pay by seeing a doctor, and that is why you haven't gone to get checked on? Some doctors may even agree to bill you if that is possible. Get copies of any of your blood tests. Is that copay or co-insurance percentage you are possibly concerned about having to pay worth more than your overall health? These are only a few possible blood and urine tests your doctor or you may want to run. Blood tests examples such as complete blood count CBC, a basic metabolic panel BMP or comprehensive metabolic panel CMP, and a lipid panel creatine, TSH, T3, T4, thyroid panel, liver panel, electrolyte tests, folate test, blood C-reactive protein test, platelet count, hematocrit, red and white blood count, CA-125 cancer blood test, glucose test, BA1C, calcium levels, potassium levels, vitamin D levels, cholesterol numbers, urine tests for possible bacteria or infections, etc. If you have vision insurance, consider having your eyes checked before the end of the year, understanding there may be costs for you too associated with that visit, but our eye health is also important. Ladies, are you having any tenderness, soreness, or lumps in your breasts that you have been ignoring? Please consider checking with your medical insurance to see if they cover prevention medical tests, such as mammogram. Speaking of lumps, do you have any lumps or swollen areas on your body anywhere that have not gone away? Do you have any moles on your body that have been changing shapes that you noticed over time? Consider having any of that looked at by a professional physician. The mole or lumps may need to be assessed with a biopsy. Are you been having a temporarily harder time urinating lately? Have you noticed a change in your bowels where you aren't pooping as you normally do? Consider getting whatever issues or concerns you may have looked at by a professional doctor, dentist, gynecologist, heart doctor, urologist, dermatologist, gastro doctor, oncologist, etc., that you trust and that can perform needed blood and urine tests needed before the end of the year. For your own health and well-being, notwithstanding the costs to your pockets, please know your numbers.